So dear students, in today's Table Viva, we shall see about the Child Health Nursing Table Viva. Okay, so already we have seen that in Nursing Foundation, which are the things. So that thing we are not going to repeat, but today we will mainly see in Child Health Nursing related to pediatric or children, which are the things specific of that table. Okay, so let's start with the instrument. Okay, so this is known as the Palladi feeding cup. Okay, so this is made up of the stainless steel. As all of us know that this is used to feed the neonate, especially when baby is premature or baby cannot suck mother's milk. That time it is advised. The advantage of this is that this is made up of stainless steel. Easily we can wash and easily we can keep. So in alternation to bottle feed, this is the best thing. You can clean with soap, water every time after the feed. So this is the tip and this is the spout. We can call it as a spout, and this is the mug, or so you can just feed the baby. So this is the Palladi feeding cup. Second big cup, this is the just simple spoon. Okay, so this also Vati spoon feeding you can give to the pediatric also, neonate baby, the premature baby who cannot suck very easily mother's milk because they are premature, they will get tired. So not to exhaust them, so that time also we can use this. So this is also you can give any medication. You measure in the measuring cup and put here and give medication, or you can feed water, you can give express breastfeeding in Vati and spoon. So in Vati and spoon this is used. So Palladi feeding cup and this is the spoon. Next we come to the umbilical cord cutting scissors. Okay, umbilical cord cutting scissors. So as the name suggests, it is used to cut the umbilical cord after the baby is born. So the parts, the rounded blades, specially designed to cut the umbilical cord. So rounded blade, here that is the joint or pin, the pin joint, and here that is the shaft and again finger bone. Okay, so there is no lock, only joint. Okay, so specially designed to cut the umbilical cord after the delivery. Once the baby is born, you do the milking of the cord, and thereafter you take one gauze, just keep the gauze over this and just cut. So when you cut, both the blade meet on each other. So easily, specially designed to cut the umbilical cord. This is reusable. You can wash with soap and water and dry it. All the sharp scissors or sharp particles, we don't send it for the autoclave, but we sterilize it by the chemical method, that is you dip into the sidex. Okay, so all the scissors are not to be sent in autoclave, but you can dip in the sidex. Chemical method we use. So this is the umbilical cord cutting scissors. Next we come to the artery forceps. Already we have repeated this, but on Table Viva of Pediatric they will place this also. So this is small artery forceps, so we can say mosquito artery forceps. Okay, so this is curved blades are there. Inside there is serration. So serration, and this is the joint. There is shaft, there is lock, red shirt lock, catch, clamp and crush, and there is the finger hook. Okay, so this is the artery. If it is straight, then you have to say straight artery forceps. If it is curved, then we say curved artery forceps. These also we can reuse, and this instrument you wash under running water with soap water and then dry it, and we can send it for autoclave. Similarly, this is known as dissecting forceps. Okay, most common instrument, these are the most common instrument used. Okay, artery forceps and thumb forceps or the dissecting forceps. There is no tooth, so we can say this is the plain dissecting forceps. So similarly here inside there are the serration, so we can say serration on the tip. Okay, On the outer part also there is the serration, so we have the better grip. So this is the serration, and here there is the joint part, no, just 1 inch. So this is plain artery forceps. If there is a tooth, then we can say tooth dissecting forceps. If there is no tooth plain, then we can say plain dissecting forceps. Okay. So the use of thumb forceps, artery forceps, most commonly used in all the procedures in medical field, in operation theatre, in OPD, in any basic procedure. No, the basic instrument used is this. Okay. So also in surgery you can hold the delicate organs. Okay, or if it is with the tooth, then you can use the rough organ, rough part of the body. Also in mouth care or in dressing, in all the places we can use this. This also can be autoclaved and reused. Next we come to the tongue depressor. Okay, so this is known as a tongue depressor, also commonly known as the spatulas. No, spatula. So this can be of the steel as well as wooden. Wooden one is the straight. So straight, rounded curves. Okay, curved, rounded blades both the side. This is single use and throw. Mainly used in pediatric, in oral examination when children have any fungal infection, thrush, all this, then doctor will use, or we can examine and just throw it. Okay, and this is stainless steel spatula or tongue depressor. So this is both the side rounded blades are there. We can use this instrument to examine the oral cavity, to depress the tongue, or in any minor major surgery of the oral cavity we can use this. The stainless steel one we can reuse by sterilization. Then we come to the percussion hammer, also commonly known as the hammer. The name is percussion hammer. So this is the triangular blade. Okay, but I am holding this part is known as the handle. Behind that there is one sharp point. Okay, so this with this sharp point you can do the plantar reflex. You can check on the plantar reflex. For that it is there. So the percussion hammer mainly used in the neurological examination. Okay, to check the biceps reflex, in the knee reflex, and on the plantar reflex. Okay, so this is the percussion hammer. Next we come to the most important thing. So these are the airway. Okay, airway. This is airways, the various size, and this is known as the most common one used are the Goodell's airway. Okay, so the tiniest one we can see, that is the 000. 000 is used for the always the measurement, or the 000 is written here. Even if you don't know, you can just turn and read it. Okay, so 000 is used for the very premature neonate. Okay, and 00 then term baby, and 0, 1, 2 is used in the pediatric age group. And then for adult, okay, adult we use 6 to 12. If bigger children, 3 to 12. So these are the various, it comes in various number. According to the patient size we use, but mainly in pediatric we use 0, 1, 2. Okay, if adolescent children are there, bigger one, 3 to 12. So the parts, this is called as a flank. Then this is inside, air is going, so air channel and the tip. Okay, so this is inserted in the oral cavity, mainly when we want to maintain the patent airway. Okay, or also you want to prevent the tongue bite in a convulsion or something is there, then you can just put, so tongue bite is prevented. So these are the airways. Airways are for the single use and throw. Next we come to the ambu bag. Okay, so ambu bag, as the name suggests, artificial mechanical breathing unit. Okay, so this is specially for neonate. Okay, just newborn or neonate or infant we can use. The bag capacity for the neonate is 300 ml. Okay, the air that much can go. So first we have to say the parts. This is mask. Okay, so rounded mask snugly can fit on the baby's nose. Okay, then this is the Fisher mouth valve. Okay, here there is the pressure valve, and this is the self-inflating bag. In neonate or in children, infant, we use specially only 3 fingers, 1 thumb and 2 fingers. Okay, this way. Not in adult we use the all full hand, but in pediatric and especially neonate we are using 2 finger and thumb this way. Okay, and we maintain the ratio of squeeze, then 1, 2, 3 cardiac compression, and then again 3. So to give the bag and mask you require 2 portions. So squeeze, 1 breath, and then 1, 2, 3 we give the chest compression. Behind this is rebreathing reservoir bag. For example, this. No? So this is this. So this is reservoir bag, and this is the oxygen inlet. You can attach the oxygen inlet here. This is air inlet. So these are its parts. So the difference between this and this is for neonate and this is for pediatric. The pediatric airbag capacity is 400 to 500 ml. Okay, and this is 200 to 300 ml. 300 ml air capacity. And adult already yesterday we had seen in a nursing foundation, that is 1600 ml. So these are the ambu bag. Okay, so ambu bag is used to give the positive pressure ventilation, especially in neonate when the baby is not breathing, does not cry after birth, and you need to give the breath to the baby, especially when baby has birth asphyxia or any serious condition, baby did not cry, then every nurse should know the bag and mask. With this simple technique, bag and mask with full oxygen concentration, you can save the life of the baby. So this is very important thing. All this should be in working condition. Next we come to the laryngoscope. Okay, so this is neonate or pediatric laryngoscope. Again, the what I hold, that is called as the handle. Okay, this is the blade. This full part is known as blade. We should know how to detach and how to attach the blade, and on what you just attach the blade, that is known as the hook. So this is hook, this is blade. You just fix this way blade on the hook, and that is the power insertion. Okay, cell battery, so it burns, and this is the bulb and bulb socket. So these are the part. So when positive pressure ventilation is not useful, bag and mask we can't continue for longer time, no. So when baby heart rate is not improving, then we go for the endotracheal intubation. So before inserting this endotracheal tube, the anesthetic or anesthetic doctor or the neonatologist, he will use this as a guide. So as the name suggests, this is the laryngoscope. So this is inserted into the larynx. Larynx is the voice box. Okay, so the opening of the trachea. Then with this this is used as a guide. So also this we use when there is tracheal suctioning, so much mucus is there in the trachea, or in the surgery time the doctor will use to provide gases, anesthesia to the patient. So as I said that along with this we use the endotracheal tube. Okay, endotracheal tube also comes in according to the size. So for the neonate we use 2.5 to 3, 3.5, all these are the pediatric. So 2.5 to 7 number, okay, we use in pediatric. Even if we don't know in exam, the names are written, you can just read it. Also the size also is written on the, if it is sterile pack, then you just turn your side and read and answer. So this is endotracheal tube used when the positive pressure ventilation bag and mask is not useful or not responding, and you need to keep the baby on ventilator, that time we are using. So this is endotracheal tube. The parts of that, this is made up of the PVC. This is bevel. Then there is Murphy side. One side opening is there, that is known as the Murphy side. These are the calibrations, and also there is radio opaque line. One line is there that it is visible on X-ray, and this is the adapter. So here you can attach the ventilator cable. Okay, in pediatric usually it is plain endotracheal tube. It is written here plain. In adult there is the cuff. Okay, so this is the difference. In adult there is cuff, in pediatric usually it is plain. So these all are the emergency articles. It is kept ready in crash cart. Okay, ambu-bag, mask and laryngoscope, airways, all these things. Fine. So these are the ambu-bag and mask along with the endotracheal tube, airways. Now we go to the other instrument. This is simple thing. This is known as the splint. Splint is made up of any material like cardboard. Over the cardboard you can just wrap the simple bandage and can be made. So in children we want to immobilize the part, especially when the intravenous fluid is going on. We want to immobilize the part. That time you can just keep baby's hand and tighten it. Okay, so to immobilize any part, very specially when there is fracture, when there is injury, when you want to keep in place the intravenous fluid or the line or the Vigo, that time specially used. Then we come next, we will go to the syringes. Okay, so syringe, this is disposable plastic syringe, single use, and the parts of that, this is the tip. Okay, the inside part, this is known as barrel. Okay, this is plunger. So plunger, barrel and tip. That is the calibration on the any syringe you take. That is the calibration. So how much you have to give, either injection or whatever you can. Syringes are used to provide IV injection, IM injection, subcutaneous, intradermal, okay, to give test dose, to flush out the Vigo cannula when it is blocked. So the syringes are made up of the plastic. There are also glass syringes. Okay, this is the insulin syringe. Okay, insulin syringe, there are units marked as a unit. So 40 unit makes 1 ml. Then there is also the tuberculin syringe. Okay, so these are the various syringes. Also there is asepto syringe to irrigate any cavity, specialty ear wash. In ear wash we use. Next we come to the needles. Okay, so needle is always come in the protecting cover. So this is protecting cover over that, and then inside part the starting point, that is called bevel. Middle is the shaft, and this is the hub, shaft and bevel. Okay, so needle also in pediatric age group we use from number 22 to 25 gauge. All the needles, if it is packed, then you can say it is single use, disposable, available in sterile pack, and behind the number is written. If you don't know by color which number, so purple is number 24, and already I said that the number 22 to 25 blue and purple is used for the pediatric. Okay, in adult we are using number 19 to 22 gauge. Okay, so 19 to 22 in adult, and in pediatric the smaller number are used. After the use, you burn in the needle burner and discard in the white container, that is specially to collect the needles. And also very specially number 18 needle, this pink is thick, bigger. So this number 18 needle is used to dilute any medication that is in the powder form. Okay, so these are the thick, these are not never to use for IM number 18, it is for the aspiration. Okay, then after we come to the intracath or Vigo, also most commonly known as the Vigo. So in pediatric, everything, all the small numbers we use for the children. So with the number we should know that yellow intracath is number 23 always. Yellow is 23, that is used for the neonate and infant. Then the parts of that, this is the protecting cover. Inside there is the catheter and the needle is known as the stellate. Okay. These are the wings. The injection port, you can just insert the injection from here. This is the flushback chamber and the lever lock. This is lever lock, flashback chamber, wings, injection port, catheter and needle and protecting cover. In children, especially neonate and infant, we are using 23 number. If it is blue, this is 22 number used in older children. If it is pink, pink number 20, it is always used in adult. Okay. Then this is called three-way cock, three-way stop cock. So this when IV fluid is going on and at a time when you want to give more than 2 fluids together or some injection or you have to give, that time more than 1 fluid or infusion you can continue with this. So, and behind that is always the tubing. Okay, so these are the three-way stop. Next one is this is known as the cord clamp. Okay, this is also available in sterile pack, single use. After the baby is born, after squeezing the cord, what we do? We keep 3 to 4 centimeter at the baby's side, baby's navel, and then you fix the clamp on the cord this way, and then we cut it the remaining part. Okay, the cord on baby's side, it falls off by 7 to 10 days by itself. But always we have to keep at the baby's side 3 to 4 centimeters. So in case there is bleeding something, you can again reclaim. This is also single use and throw. Then these are the also known as scalp vein and butterfly. Normally we call it as a butterfly or scalp vein. So this is used in alteration with this. Okay? So when you do not get any vein, when dehydration is there, very old patient, then this for temporary giving infusion you can use this. Or also to irrigate any cavity in plastic surgery, these are used. Or when you want to give small amount of IV fluid or injection, it can be used. So that over the needle is the protecting cover, hypothermic needle, and that is the wings, catheter and the lever lock. Okay, so this is butterfly. This is dropper, also known as pipette dropper. So with this you can take drops and give, especially when neonate is there, multivitamin drops or any medication. It is prescribed as 2 drops, 4 drops, 5 drops. So you just press and release in the bottle, then the suspension will be filled in this. And then again, according to the prescription of the doctor, you put 3 drops and 1, 2, 3. This is very useful, especially when the drops are to be given to the baby, or also when other thing, especially in adult also, you want to give some drops, that time you can give this, especially mainly used in pediatric in the neonate. So prescribed drops can be provided with this. After washing you can reuse. Okay, today if it is BD, morning you give, then again you replace, and evening again we can give. So next one is the measuring glass or measuring cup. Pediatric always it is given that 2 ml, 5 ml as per the baby's weight and age. So that is the calibration over the transparent glass or the cup. So according you can measure and give. So this also is reusable. After giving medication we can reuse it. Next we come to the IV. This is known as the Pediaset or volume measuring unit. Okay, so it is in alteration to infusion set. No, in adult yesterday we saw, or in that FON Nursing Foundation Table Viva already I explained the normal infusion. Okay, so in addition to that, no, when the smallest dose is to be given, for example 100 ml for 12 hours. No, so the smallest dose can be measured in this and the drops can be adjusted. So mainly used in patients, especially in neonates, in infant, in children, no, when small amount of fluid has to be given. So the parts, that is the cover, protecting cover, this is inside is the spike, okay, tubing, this is the clamp, hanger, okay. Here is the injection port, you can put injection, this is the air entry, this is known as the chamber, over the chamber there is the calibration, and there is one yellow ring. When you fill the fluid, the yellow ring floats on that, so that is the indicator that how much, where is the fluid in the chamber. And then there is the filtration, okay, so needle and the filter, again tubing, regulator is there, and then the injection side and the connector connected to the Vico. So this is very specially used in pediatric age group and it is always kept on pediatric table viva. The name is Pediaset or volume measuring unit. Okay, volume measuring unit. Similarly, there is the blood transfusion set. Blood transfusion set, especially when we have to transfuse blood, no, that time specially this blood BT set is used, known as BT set. BT set is exactly just like the infusion set, but what is the difference? The size of it's little bigger. Okay, the spike is bigger, the chamber is big, and in full chamber the filter is given, so that in case any blood cells are there, any clot is there, it will get filtered. That is the tubing. Regulator also is big, so that you can regulate, and then there is injection side, needle and the protecting cover. So the only difference, it is bigger in size, the filter is quite big, and in the full filter, full chamber, the filter is given. That is only the difference. All the plastic catheters are to be discarded, cut and discard in the red container, no, in biomedical waste. Next we will go to the Ryle's tube. No? So Ryle's tube, in adult we call it as a Ryle's tube. No? This is for adult Ryle's tube. In pediatric age group we are using this, is known as the infant feeding tube. No? It is written feeding tube, commonly known as the feeding tubes. In children we don't tell it as a Ryle's tube. Doctor always will ask you that give me feeding tube, then you have to understand that this we have to give. Okay? So this also in children 5 to 14 French, it is measured in French. So 5 to 14 we are using. 5, 6, 7, 8 in premature baby, 5, 6 mature baby, 7, 8 you can use. So this is again given to provide feeding to the baby. Also when you want to give stomach wash or you want to obtain gastric juices for analysis, also you can use. So the parts of that, here is the lever lock, then feeding port after that, that is full tubing, and that is the calibration on that, and this is the side opening through which the feed will go into the stomach. Okay, how to measure how much to insert inside? So from nasal nose tip to the earlobe to the zip is sternum. Okay, and that much distance you have to insert through the nose into